Part of my work now, I talk to couples. I think the most recent case is a gentleman who's negative and dating a HIV positive woman. So he understands everything, but he kept saying, what if? I tested in 1999 and was a student at Stellenbosch University. I don't even think I knew a lot about HIV at the time. HIV was still a hard thing to talk about. The people that, what you hear about HIV is people who are dying from AIDS. And as much as I was not feeling well, but I didn't look like a person who had AIDS. Mentally, it was tough, and there was not a lot of people who you could talk to. The doctor referred me to a social worker. And then I walked in and I gave a note, but he looked as confused as I was. At the time, it didn't make sense, but then as the more I got involved in the HIV work, I realized that the level of education around HIV at the time, it was not well. I think I was lucky because I found a circle of people who were also living with HIV who had kind of 2 years ahead of me or a year ahead of me, and they could just, no, don't, you'll be fine, and that really helped a lot.
So I lived with both HIV and depression, but I did not accept the diagnosis in 2007. I couldn't. I was saying, not me. I come from a family that is okay. There's nothing that is depressing me. I don't have children. I have no issues with money. I'm okay, so why would I be depressed? We need to get our healthcare providers to understand the link between HIV and mental health.
I've been taking my medication for, I think, 14 years now. So I packed my medication for a week. And a week later, I went into my pill box, it was still full. And I realized that I had not been taking my medication. It was not a conscious thing to do. But when I kind of reflected, I then realized that I just got tired. I just got tired of taking the medication and I stopped.
The mental health of every patient will lead to whether they are defaulting or not. And if they're not okay mentally, they will default.
It's the journey of deciding that this is not going to control me anymore. You have the internalized stigma. That's the hardest one. Even if somebody says, look, I care, I'm accepting you, you wonder, what if he leaves me? What if she leaves me? What if he infects me? You have to really have a relationship with yourself and the issues that you're dealing with. So you need to capacitate yourself through, talking to other people. I think talking to other people is one of the best way to help yourself calm down.
The HIV cycle doesn't stop. These friendships become meaningful because I know that I can always call on Pulu at any given time. No one else understands us better than we understand each other and where we come from. When I have a problem, I know I have a friend.